Welcome to week 4 of your Pharmacology 1 course. This week we are covering chapter 5 in your textbook. This chapter is entitled Using Drugs Therapeutically, and there's really a ton of different topics that are covered in this particular chapter. So I'm going to kind of just go over a high-level overview of some of the things that you're going to be learning about. You're going to be learning about some of the effects that drugs have on your system, on the body. You're going to look at the difference between local and systemic drug effects. You're going to look at things like therapeutic effects, side effects, adverse effects, the target organ, how to reverse drug toxicity, the actual physiological response that we have to an allergic drug reaction, and then all of those drug-drug interactions, drug-food interactions, all of those types of things. Then you're also going to be looking at how we measure drugs. So the metric system is one of the units of measurements. Then also things like units, milliequivalents, things like that, as well as some of the abbreviations for some of those things. Then we're also going to look at drug dosing for adults, infants, and patients that are on chemotherapy. And then the last thing you're going to look at is the 5 rights of drug administration. So again, there's a ton of different topics in here. So let's just look at a couple things that I want to make sure to point out to you. When we talk about how a drug works in your body, what we're looking at is things like prevention, diagnosis, and treatment. So what is it going to do to you? And then anything else that we introduce to our body, like other drugs, food, alcohol, those types of things, can all have an effect on how those things work. So whether or not they actually prevent the things that they're supposed to prevent. For example, one that comes to mind right away is birth control pills. If you were not aware, if you take an antibiotic along with some birth control pills, it can keep it from working. So the birth control pill is to prevent conception. However, when you take the antibiotic, it's going to reverse that effect. So again, it's just one of the many drug-drug interactions that you're going to learn about. The way a drug actually works is that it works by initiating things through the receptors within cells. It's kind of like a lock and key mechanism. The receptors themselves are the lock, the drugs are the key, and only certain drugs work with certain locks. So you have to keep in mind that not everything is going to necessarily work if that drug doesn't work with that particular lock. So the whole idea of the lock and key is really essential to understanding how a drug works in the body. Now, one drug can act as a master key, so it can do more than one thing at a time. We have lots of different types of locks. They talk about those in this particular chapter as well, and then what works on those particular locks. The next thing that they talk about is the effects of those drugs. Drugs can have one of two effects. They can have what we call a local effect or a systemic effect. A local effect means that it works right there at the site of administration or in the immediate area. So, for example, maybe we're talking about something simple like using hydrocortisone cream on a bite, something that itches. That is a local effect. A systemic effect is something that's going to happen throughout the body. So, some of the medications that are given for pain are going to be used and felt throughout the body. So it's not going to affect just the pain receptors. For example, morphine is a great example. It not only affects the pain receptors, but it's also going to suppress the respiratory system. So those are some things that you need to keep in mind when you think about those two things. Then we also have what's called the therapeutic effect. The therapeutic effect is what we want the drug to do, why it was prescribed. So what is it doing? Is it preventing a disease? Is it going to treat something? Is it going to help a symptom? Whatever. So that's the therapeutic effect. The things that happen in addition to those are typically known as the side effects. So those things that come along with the therapeutic effect are considered side effects. Some of those things may be mild, like nausea, things like that. Some of them can be, dangerous. So, if you have an anaphylactic reaction, that's considered a dangerous side effect. Then we have the adverse side effects. They're not as common, but these are things that would be severe enough to cause the manufacturer or the FDA to remove them from the market. And it can happen either way. The manufacturer can remove it, the FDA can remove it. So those are all some things that you're going to be learning about. You're also going to look at some history behind some drugs that were removed from market and the reasons why. You're going to be looking at toxic effects of some medications, allergic reactions of some of these medications, and then you're also going to start looking at drug-drug, drug-food, all of those types of interactions throughout this chapter. If at any point you have problems or questions, please make sure you reach out to me, and have a great week.